The vast majority of people in Britain who died in September were fully vaccinated. 1,270 out of 1,500 were fully vaccinated. 607 of the 70-year-olds out of 800 were fully vaccinated. 258 out of the 411 60-year-olds, they were almost all fully vaccinated. Most people who die of this now are fully vaccinated in the UK. Those are the numbers.
Okay. So it's not right. I'm sorry. It's not accurate. It's wrong. I hate saying that. Okay. Here's why. Okay. So I'm going to be analyzing and critiquing Alex Berenson's claims on the Joe Rogan Experience that vaccinated individuals are getting COVID more and are dying of COVID more, therefore undermining the validity that getting a vaccine is a intelligent choice to protect you from dying and to protect you from transmission. We'll be analyzing his claims he made on the Joe Rogan Experience because there are some things definitely to agree on, but unfortunately there's some statistical errors that he made that can have really big consequences when you say that to millions and millions of people that I would just like to address here. So we're going to be bringing Alex on the screen in a moment here. Alex, why don't you join us? Here we go. And just going to run you guys through what he said, just so you have context.
All right, so this is week 34 through week 37. That's going to be basically September. So this tells you the rates. Oh, yes, this is great. Rates of illness among people who have and have not been vaccinated over on the right. So what you can see is that in people over 50, rates of illness are higher in the vaccinated than the unvaccinated. 900 to 600 in people 50 to 60, 600 to 400 in people 60 to 70, 500 roughly to 360. In each of those cases, the number in the second to last graph, the second to last column, is higher. So what that's telling you is that people who are vaccinated with 2 doses are more likely to be infected with SARS-CoV-2 than people who are not who are not vaccinated.
It's interesting how it changes somewhere around 40 to 49.
That's right. And there's a good scientific reason for that, which is basically there's something called immunosenescence, which basically means that your immune system, as you get older, has a harder time dealing with disease, right? That's sort of like...
Cool. Let's go there and pause there. 100% number one, just to agree, immunosenescence, where aging... Via the aging process, your immune system is less capable to fight pathogenic viruses. That's pretty clear, okay? We can agree upon that. Now, let's look into now the actual claims that were being made in the statistics right here. 100%. What we are seeing is what he's saying. The interpretation is correct, but the why is a bit more nuanced. And the why is important because that can then infer certain actions you take from why are we seeing more people vaccinated? Because here's what people are going to do who are not vaccinated or who are maybe even vaccinated and be like, maybe I made a mistake. What am I doing? And they start resenting this whole process is they might see this. So in the yellow, I have indicated people who have 2 doses of the vaccine, okay? And they have presented with COVID. They got COVID. That's clear. From the 40 to 49 age group all the way to 80 plus, it is consistently clear based off this population data from these medical servers that more people who are vaccinated got COVID. And so you might think, well, what's going on here? Because then in the groups beforehand, those people, it was the other way around. More people who are unvaccinated got COVID. And then I did a little percentage just to show you guys the percentage of not vaccinated. For example, in the 18 to 29 group, it was 32%. And then when we go to the 40 to 49 group, where we say, oh, this 1,100 figure of people who got COVID, who were vaccinated, like, oh, that's strange. Well, 13% of them were actually not vaccinated. So we see this trend of increased non-vaccination occur in the earlier age groups or the younger age groups, and then increasing vaccination status all the way from we get 80 plus, only 4% are unvaccinated. Okay, so what we are seeing here and why we are seeing the data appears correct, okay? Now, the why, the aging process contributing to your immune system waning, absolutely. But what we are seeing here is basic statistics and population ratios. So, for example, once you start to see the majority of a population in a society who's unvaccinated, right, you're going to see a lot more of them turn up in hospitals, get sick, and die. Makes sense? Majority of people are unvaccinated. Now, once the majority are vaccinated, over 6 to 12 months, now the majority of people are vaccinated, by proxy of the majority of your population being vaccinated, you will begin to see a lot more vaccinated people in hospitals dying and getting COVID. Why? Well, you might think, oh, see, the vaccines don't work. They're ineffective. Maybe you shouldn't get them. I believe that's the contention of Alex. I did watch the whole podcast. Apologies if I'm misrepresenting you in any way, Alex, or anybody who knows him and wants to send this through to him. And so what we see is that as the population ratio of people does more of a thing, eats more food, it gets more of a vaccination, if more people are vaccinated, just by happenstance of that characteristic that they have, more of them are going to have a tendency to end up in hospitals, get COVID, compared to those who don't, because the majority of the population are now vaccinated. Plus, let's acknowledge vaccine efficacy wanes over time as well. That's an important consideration in all of this, because as the time point continues, as more time goes on, we will begin to see lower neutralizing antibodies, hopefully some retention of memory T cells and B cells, but these neutralizing antibodies wane and more people get a virus. That makes sense. That's a consideration and its own critique of these vaccines that I think holds a lot of weight with that waning efficacy. And so this is why we have to stratify the data and compare unvaccinated versus vaccinated and weigh relative risk versus absolute risk, and then the ratio within a population. So number one, I think we just missed the point, unfortunately, that the majority of the people, and they actually, funnily enough, Joe and Dr. Sanjeev Gupta brought this up in the next following podcast, where Sanjeev brought up this point exactly, that, well, we're going to see more vaccinated people by virtue of them being more vaccinated people. It makes sense just from a sheer statistical standpoint. But if there's any high expert statisticians or research method experts that would like to critique my scientific analysis of this, please, I'm not trying to be right. I'm just trying to be truthful and accurate. I don't care if I'm wrong. I encourage being wrong, because that means I can learn and we can come back here and address, the error that was made and help people make a more informed decision. Moreover, the actual document to which this data is in, just a couple pages beforehand, explains and interprets the reasoning behind why we see this, that Alex just seemed to either not acknowledge or just skip over entirely. These data should be considered in the context of vaccination status of population groups shown in the rest of this report. Vaccination status of cases, inpatients, and deaths is not the most appropriate method to assess vaccine effectiveness, and there is a high risk of misinterpretation, as potentially we're seeing here. So basically, they're demonstrating their own error in their own data. Vaccine effectiveness has been formally estimated from a number of different sources. This is the point here. In the context of a very high vaccine coverage in the population, even with a highly effective vaccine, it is expected that a large proportion of cases, hospitalizations, and deaths would occur in vaccinated individuals, simply because a larger proportion of the population are vaccinated than unvaccinated, and no vaccine is 100% effective. This is especially true because vaccination has been prioritized in individuals who are more susceptible or more at risk of severe disease. So individuals in risk groups may also be more at risk of hospitalization or death due to non-COVID-19 causes, and thus may be hospitalized or die with COVID-19 rather than because of COVID-19. And that is why we have to stratify the data across specimen date time periods. Funnily enough, I don't like pointing this out, and it's not about people's character, but unfortunately, he just skips over this next table when we talk about hospitalization or rather emergency care within 28 days of a positive specimen, which is 28 days of actually getting COVID tested and collecting the data. And so what we see very consistently, and I didn't expect to see this. I thought, okay, well, I kind of did, but, this is what it is, at least in this UK data, there is no variance here. While while vaccinated people are actually getting COVID, which for a number of reasons we mentioned earlier makes sense, it appears that those who are ending in overnight inpatient admission are consistently people who are not vaccinated. Like there isn't a single age group that is vaccinated who is turning up more so in hospitals compared to vaccinated. Now, this is really an important marker here because now this is talking about severity. While you might get it if you're vaccinated, you might kick at them a lot more effectively if you've either gotten COVID before with natural immunity or you have a vaccine. And so this is an important statistic to mention because we want to reduce hospital admissions. We want to reduce time. Like it's very costly on the medical system. No one wants to spend time in a hospital. Screw that. So if we can reduce time that people can have, reduce severity of a certain disease, and a vaccination can help that, and it's more beneficial. If it's more beneficial to do so than get a virus, then maybe that's a smart decision for you, depending on your own risk factors. You know, you have all the age groups here. All of them end up in the hospital less. I would consider the biggest variances are between older age groups. For example, the under 18, the relative difference is very small. 18 to 29, 30 to 39. It's not huge, but it's really once we start increasing the age range from 40 to 50 to 60, do we see this much larger variance between hospitalization rate versus vaccinated and unvaccinated. Again, I don't care about this UK data. You could pull any country data. I'm just responding to claims being made. And he does make one more that I would like to point out just right here.
Like intuitively obvious. It also has a harder time mounting the response that the vaccines are supposed to help with. So that's one chart. And again, this is UK government data. And what it says is that the idea that this is a pandemic of the unvaccinated is a total lie. You are more likely to become sick if you are vaccinated than if you are not, and you're older.
Just to, it's quite emotional right now. I get it. He wrote a book about this. He cares a lot about these ideas, and I'm sure he's researched a hell of a lot. But the intention from his contention is that it's because vaccines don't work or aren't effective, rather than an explanation of statistical changes in data. And that's very different reasons to claim.
There are categories.
In these older categories.
So anything above 50
actually
is where
above
the number
40,
shifts.
if you see, because 40 is actually the highest number of all. There's 1,150, so it's about 1 in 100 people in those 4 weeks in 40 to 50-year-olds.
Right. So before 40, it seems to shift in favor of the vaccinated.
Yes. Now,
so would you make the argument that if you're younger, you should be vaccinated?
No, because in that case, your risk of underlying disease, you're very likely to recover very quickly from COVID if you're not.
If you're younger.
Yes.
Right,
So let's go to the next page.
That's fine.
Okay,
Sure.
this is emergency
Like,
care. Go next
fine.
page. Okay, so these are deaths.
So
okay.
skips over that page I just mentioned about hospitalizations. I hope because it wasn't agreeing with his contention and that he just did it because he missed it. I want to give people the benefit of the doubt, and I hope people aren't cherry picking data, but they do all the time.
Now, this is on a per 100,000 basis. So what you will see is that vaccines. Look at the third from the left. Third from the left. Second dose more than 14 days above specimen date, before specimen date. These are people who have died. Fully vaccinated people who have died. There were 1,270 fully vaccinated people who died out of 1,500 in the over 80 category.
But this is under 14 days before specimen
No,
date?
over. Second dose greater than 14 days means I am fully vaccinated by anybody's definition.
Okay.
Not vaccinated, it says, when it says second dose before 14 days or more than 14 days, what it should say is fully vaccinated. That's what that means.
Why does it differentiate between that after 14 days and then the next one is rates among persons vaccinated with 2 doses?
Okay, so I promise you I will answer that question.
Okay.
But what I want everyone to see is that the vast majority of people in Britain who died in September were fully vaccinated. 1,270 out of 1,500 were fully vaccinated. 607 of the 70-year-olds out of 800 were fully vaccinated. 258 out of the 411 60-year-olds, they were almost all fully vaccinated. Most people who die of this now are fully vaccinated in the UK. Those are the numbers.
Okay. So it's not right. I'm sorry. It's not accurate. It's wrong. I hate saying that. Okay, here's why. Okay, at least to my understanding. Okay, as a scientist, someone who studied research methods, I ain't no statistician, but this is It's just pretty basic stuff, but maybe I'm an idiot. Maybe I got something wrong here, but let me explain what we're talking about. So he claims that most of the people dying are vaccinated. And eventually, I believe that's actually will be true. Why? Because the majority of people in a population will be vaccinated. So, of course, the majority of people who are vaccinated will begin dying. It makes sense. If 95 or 90% of 80% of your population is vaccinated, at some point, more of them will begin dying. Anyway, especially as time goes on and, efficacy wanes and antibody efficacy wanes. Cool. All right, but hopefully not if there's some level of protection with memory T cells and B cells. But anyway, let me get to the claims. This is COVID-19 deaths within 28 days. Within 60 days of a positive specimen or with COVID-19. The column he was referring to was second dose more than 14 days before specimen date. And so he claimed that specimen date meant vaccination, two doses of the vaccine. And he said he promised he'd explain why the difference between rates of people vaccinated with 2 doses. Joe correctly asked, why is there a difference here? Well, okay, so if it means that people are vaccinated here, why do we have a separate column in the table for that? That wouldn't make sense. You don't repeat yourself in tables with the same data. Okay, the reason is because specimen date doesn't mean fully vaccinated. Specimen date is the date the blood, urine, saliva, or whatever sample is collected. Specimen date is a definition in the context of here of when the person got COVID tested. So 1,000, okay, let me just confirm that. This is not just me making this up, okay? I have 2 sources here. You can go, this is the government, it's a UK government website from Wales, okay? And so you can pause the video and read more detail, but the specimen date is the date the sample was collected from the patient. Since the time taken to test samples and report the results vary, new cases reported on a daily basis in the headline summary in the Public Health Wales may be distributed across a range of specimen dates. So they're stratifying the data based on when the COVID test was done, because that can help indicate to you what caused what. It gives you a time point of, okay, well, if someone was COVID positive here, then we can establish some type of an association that they died or they were sick X, Y after that, okay? Number 2, this is from my own Australian government website, a brief definition. The specimen collection date is the date of which a sample or substance or material, for example, tissue, blood, urine, was collected for diagnostic examination or evaluation. Okay, therefore, it is not 1,272 people that died who were fully vaccinated. That's not what it's saying. What it's saying is there were 1,272 people in, for example, the 80-plus age group who received their second dose of the vaccine 14 or more days before they had a COVID test. That is what specimen date is defined as. So in other words, there were 1,272 people out of the total. This is not people who died. This is the total sample within this age group. So the total sample within this age group was 1,521. Out of this group, majority, 1,272 out of this total sample, who got their second dose 14 or more days before their COVID test was done. That is all it means. This is not deaths. This is a stratification of when people got tested versus vaccination date. Drawing attention to the main area of this graph, or this table, and that is rates among person who are vaccinated. They just compared 2 doses per 100,000, and you can see, and then they compared it to among non-vaccinated, under 18, it's null. I don't even think we should really consider all the way up to 49 to be any significant difference. Okay, death doesn't appear, at least let's just look at this data, not all the other data, that's take us forever. death does not appear to be a considerable factor and risk factor for people up to the age of 49. Maybe you could even make the argument to 59 versus people who are not vaccinated versus vaccinated. Like, we're talking about pretty small differences here. Okay, this is, if death is the only thing you're concerned about and you're not concerned about anything else, which I think there's other things to be concerned about. But if you're only concerned about death and you're under 59, okay, you can kind of make a case, at least in the UK, you kind of make a case that don't really care what I do. I'll get COVID, I'll get a vaccine. It's like, all right, whatever, okay? However, one, it does show consistently that people who are unvaccinated appear to die at a higher rate than people who are vaccinated, okay? In the 60 to 69 plus group, 70, 72, 9, 80 plus, that's when we start to see, a considerable increase in rates of death among unvaccinated. Again, there are covariates in this. There are people, if you're older, you're more likely to have comorbidities, and you're already at an age where there's other risk lifestyle factors, immune system robustness, immune deficiency, like all these other covariates that are going to impact your ability and increase your risk of dying from a disease like COVID is going to be increased, of course. So there's other covariates it might not have been COVID that killed some of these people, of course. All right, let's consider that. But once we start to get to that age range, the relative difference between vaccinated versus not vaccinated appears to be sizable. And worth consideration that vaccination does make an impact, at least in the acute phase, weeks and months after vaccination, for the outcomes of death, particularly consistently the outcomes of hospitalisation, and in more nuanced way, only the outcomes of transmission if you're under 39, with the understanding that more of your population is vaccinated, above 49, and thus vaccines may not present much reduction in risk for transmission and getting COVID, versus things like hospitalization, severity, and death. You guys can see this shit is complex, okay? We can't just look at one outcome. We look at severity, we look at death, we look at hospitalization, we look at transmission, we look at long-term side effects. We look at all these variety of things, and we need to measure accordingly to each different parameter, because different people are going to care about different outcomes. In totality, it appears, at least within the first 6 to 12-ish months, that vaccinated individuals, particularly those who are middle-aged and older adults and elderly, appear to benefit the most from being vaccinated. At least when we look at the UK data, and then you can look at the hours of other videos I've done on this channel, Strength of Saad, before. This is it's not made to defame anyone's character or intentions, but we have to exercise a level of skepticism anytime someone has a certain agenda or bias to purport their ideas when they have money involved or a brand involved. For example, I have a brand involved. Like, you should be skeptical of me because I do want, of course, I would like more people to follow me and learn from the things that I'm putting out there, because I really care about education and I want to disseminate as accurate and truthful information to help people critically think and evaluate information, make up their own informed decisions more accurately, and just ease a bit of the burden of the overwhelm. So that's an agenda I have to grow in that sense, but there's no money involved for me. I didn't write a book like Alex did about COVID. But you see, the problem is, if he says he's wrong, if he admits he's wrong, he probably won't reply to these claims, because unless he figures out I'm wrong, which I could be, and that's fine. But if he is wrong, he'll probably find every way to try and prove he's not wrong. And maybe because why? Because money, because a book, because oh shit, maybe some of the shit I wrote in my book is inaccurate, or maybe maybe I've learned new information and actually this was what I said was inaccurate, and that's okay. That's fine. That's a learning experience. But I think that's why you have to be careful about people cherry picking information. Again, I'm not saying Alex did that intentionally. I'm saying he may have. There's a risk for it, particularly when there's you're on a really big podcast and you have some authority there, and you have a book that's going to make you hundreds of thousands of dollars, and of course you want to double down your ideas because it's going to help you make more money and spread the idea and information that you think is correct. I don't think he has malicious intent. I think maybe there was just an error made on confirmation bias potentially. I definitely agree with him that politicians and governing bodies, purporting that the vaccine is going to be the way to the pandemic, or not telling you that efficacy is going to wane over time, and not telling you that you can actually keep spreading the virus even with it, and even get it with the vaccine. And many older people are still being hospitalized and dying. Like we definitely agree on that. And Alex, or someone who knows Alex, is watching. I have a podcast on my other channel that I invite you to come on and discuss these ideas if you are interested. And so in summary, people who do have the vaccine are definitely still getting the virus, transmitting the virus, ending up in hospitals. Some of them are dying. Absolutely, yes to all, but having to understand that relative population changes that are occurring for people that are vaccinated versus unvaccinated, and applying that those statistical changes to your interpretations of the data and the risk associated with it, meaning that just because more vaccinated people are ending up in hospitals, we need to ask why that is the case, because that will inform our decision of what's to come next in regards to what decision do I make and why is it happening? Is this a beneficial decision for me to get vaccinated or not? The why people are turning up is important. We covered numerous examples of why that is, from waning efficacy to aging population, immune system deficiency, greater dysfunction, all the way to the main point, which is a statistical difference in population who are vaccinated versus unvaccinated. And then that is not just the only outcome we need to look at. We also need to look at hospitalization. We also need to look at deaths, and trying not to cherry pick data to confirm our bias, and at the same time doing our best to correct our errors, or maybe when we unfortunately misinterpret data, or try and slow down with our data interpretation, because we can accidentally make errors that can inform and influence millions of people. And I think that's why I was kind of inspired or motivated to make this video, is because I realized that a huge amount of people will consume Joe's podcast, and that podcast in particular, and may make a decision based off that. So I hope this can help shed some light on a more accurate version of the UK data that he was discussing, and help people make a more informed decision to what they should do, and help quell some of the overwhelm that I know a lot of people are feeling. I may have gotten some things wrong. It's going to happen. And if I did, let me know. If there's any scientists or statisticians out there, experts in research methods and statistics, who saw, hey, that's not right, let me know, because then I need to either take the video down or make a new one. And that's pretty important to me, because I'm not trying to be right. I just want to be accurate and as truthful as possible, so we can help educate, inform, and improve the quality of life of as many people as we can. I'll get off the soapbox now. Alexander, Strength of Saad. Thanks for watching. Leave your comment below. What do you guys think of Alex and his claims, and my analysis and critique of them? See you in the next one.